Questions 621 to 640. 621. Child has a third-degree burns of the hand, chest, face. Which nursing diagnosing takes priority? A. Ineffective airway clearance. B. Disturbed body image. C. Impaired urinary eliminations. D. Risk for infection. The answer is A. Ineffective airway clearance. 622. A woman has polycystic ovary syndrome, which is 3 cm in size. What should the nurse do? A. Repeat the ultrasound after menstruation. B. Remove it by laparoscopy. C. Give the medication. D. None. The answer is A. Repeat the ultrasound after menstruation. 623. A home health nurse has entered a home to complete an admission assessment on a patient who has a methicillin-resistant Staphylococcus aureus (MRSA) urinary tract infection. The patient will receive intravenous anti-infective via a peripherally inserted central catheter, PICC, for 3 weeks. Which of the following actions should the nurse take first? A. Shake the patient's hand. B. Place the nursing supply bag on a clean, dry surface. C. Obtain the patient's written consent for home health care. D. Perform hand hygiene per the agency protocol. The answer is D. Perform hand hygiene per the agency protocol. 624. Which of the following patient is the most appropriate to delegate to a new nurse? A. Patient on a strict bed rest. B. Patient for discharge teaching. C. Patient scheduled for an operation. D. A patient who is hooked to mechanical ventilation. The answer is A. Patient on a strict bed rest. 625. An 8-year-old girl is seen in the emergency department because of a fracture in the right fibula, and she has a fiberglass cast on her leg instead of a plaster cast. Which of the following is an advantage to use a fiberglass cast? A. Cheaper. B. Dries rapidly. C. Smooth external. D. Shape closely to body parts. The answer is B. Dries rapidly. 626. 62-year-old female patient is admitted for her left eye cataract removal. She has cataract in both eyes with no visibility in her left cis. She is scheduled for the surgery. What essential safety precautions must be assessed preoperatively? A. Assess and document visual acuity of both eyes. B. Knowledge to prevent eye injury after surgery. C. Cleanliness of eye and removal of eyeglasses. The answer is A. Assess and document visual acuity of both eyes. 27. A newly graduated nurse is inserting an intravenous cannula into the midcephalic vein of a patient who is being admitted to the unit. As she withdraws the needle, a nurse calls out for help from another patient's room. The new nurse rushes to help. She secured the intravenous catheter and threw the needle into the wastebasket instead of the sharps container. When asked who had thrown the needle into the bin, the new nurse admits that she had made that mistake. Which professional act best describes the newly graduated nurse's response? A. Responsibility. B. Accountability. C. Assertiveness. D. Leadership. The answer is B. Accountability. 628. A 50-year-old man presents to the emergency department after having suffered a fall while practicing mountain biking. He appears confused and disoriented. His friend reports that he had been thrown over the handlebars and hit his head against a rock. Blood pressure 108/66 mmHg. Heart rate 102/min. Respiratory rate 22/min. Temperature 37.22 C. Oxygen saturation 99% room air. Which initial intervention is the most important? A. Intravenous infusion. B. Oxygen administration. C. Cervical immobilization. D. Trendelenburg position. The answer is C. Cervical immobilization. 629. A 24 weeks pregnant mother is in the antenatal clinic. She is upset and crying about having her third baby girl as her family wants a boy. She is requesting an abortion immediately before her family finds out about the sex of the baby. Which of the following is the most appropriate plan for the mother? A. Calm her down and reassure for an appropriate solution. B. Provide moral support and book her for procedure. C. Repeat ultrasound and wait for a few more weeks. D. Family counseling and follow religious guidance. The answer is A. Calm her down and reassure for an appropriate solution. 6:30 A postoperative nurse assesses the newly formed stoma and skin of a patient who is 1 day postoperative following a procticolectomy with the formation of a permanent ileostomy. Which of the following clinical findings would necessitate immediate care? A. Bright red and moist stoma. B. Dark red and purple skin. C. Bloody liquid in pouch. D. Ulcerations with a rash. The answer is B. Dark red and purple skin. 6:31 A 45-year-old man is admitted to the surgical ward for stoma care. The stoma appears a dark red to purple color, is slightly swollen and leaks a scant amount blood. There is no presence of stool around or on the site. Which observation requires immediate attention? A. Color. B. Edema. C. Absence of stool. The answer is A. Color. 6:32 A nurse is taking care of a patient who underwent abdominal surgery 3 days ago. The patient has not been able to breathe deeply and uses to get out of bed since the surgery due to pain. Also, the patient complains of shortness of breath, and the lung sounds are diminished on auscultation. Blood pressure 120/70 mmHg. Heart rate 75/min. Respiratory rate 22/min. Temperature 36.4 degrees Celsius. Oxygen saturation 89%. Which of the following conditions should the nurse suspect? A. Sepsis. B. Atelectasis. C. Congestive heart failure. D. Emphysema. The answer is B. Atelectasis. 6:33 What do the standards of pain management dictate nurse do? A. Avoid the use of the word pain. B. Screen for pain at each encounter. C. Discourage around-the-clock dosage of analgesics. D. Administer analgesics via injection whenever possible. The answer is B. Screen for pain at each encounter. 6:34 A nurse is planning postoperative teaching for a patient undergone left partial mastectomy. On the third postoperative day, the nurse teaches the patient to elevate the arm above the heart several times per day. What does this exercise reduce? A. Pain. B. Infection. C. Hematoma. D. Lymphedema. The answer is D. Lymphedema. 6:35 33-year-old patient in her 13th week of pregnancy has come for her routine gynecological appointment. According to the ultrasound, her fetus is a female. She already has 3 daughters, but her family wants the male child, so she asked the nurse guidance to terminate her pregnancy. The nurse explained that baby's gender is determined by the father. She later involved her husband in the discharge planning and finally helped the father agree to continue the mother's pregnancy. What professional obligation is fulfilled through the nursing implementation? A. Influenced decision-making. B. Incident prevention beforehand. C. Empathetic leadership approach. D. Sympathetic knowledge sharing. The answer is A. Influenced decision-making. 6:36 Conscious victim of a motor vehicle accident arrives at the emergency department. The patient is gasping for air, is extremely anxious, and has a deviated trachea. What diagnosis should the nurse anticipate? A. Pleural effusion. B. Tension pneumothorax. C. A pneumothorax. D. Cardiac tamponade. The answer is B. Tension pneumothorax. 637. A nurse calls together an interdisciplinary team with members from medicine, social service, the clergy, and nutritional services to care for a patient with a terminal illness. Which of the following types of care would the team most likely be providing? A. Palliative. B. Curative. C. Respite. D. Preventive. The answer is A. Palliative. 638. A 46-year-old patient is admitted in the female back pain which is graded 6 on the scale of 10 with a slight elevation in her blood pressure. The eat lunch, which is a low-sodium diet, documented that patient is uncooperative and lunch. What can be assessed by the nursing document patient? A. Subjective judgment of patient's statement. B. Misunderstanding of patient's attitude. C. Understatement of communication. D. Unethical evaluation of reality. The answer is D. Unethical evaluation of reality. 639. The nurse is assigned to care for several patients, who should be assessed first by the nurse. A diabetic patient who will be discharged. B. The patient with rheumatoid arthritis who has. C. An asthmatic patient who is due. D. A patient with surgical incision who require. The answer is C. An asthmatic patient who is due for. What sequence should the nurse follow? A, D, F, G. B, C, G, A. C, D, E, F. D, E, F, G. The answer is B, C, G, A.